Right, so I think it's really good to make a start because you've all got very busy calendars. So a warm welcome on a cold day to our International Evidence Collaborative seminar. And this will be the first of a series of seminars talking about evidence, new and emerging evidence in social prescribing. So firstly, can I say it's a bit of a who's who on the participant list of people that are busy in all sorts of aspects of social prescribing. I'm looking at names from people that have been at conferences we've run and all sorts. So it's fantastic to see you all. I do miss seeing everybody. But for those that don't know me, I'm Dr. Marie Polly, and I am co-lead with Professor Helen Chatterjee of the International Evidence Collaborative for NASP. And you may see me in other roles like co-chairing a social prescribing network and things like that. So before I say anything else, Anne, can I hand over to you? So Anne is Head of Evidence for the National Academy of Social Prescribing. So Anne, come and say hello to everyone. You're on mute, Anne. There we go.
Is that unmuted now?
Yeah.
I did press the button, it didn't unmute. Thank you. I'm not going to delay things. I just wanted to extend a great big thank you to everyone, a welcome really to everyone that's on the call today. Like Marie, I'm delighted to see so many familiar faces on the call. It's wonderful. NASP is really committed to helping shape a shared research agenda and to facilitate the collaborations that we need to help drive that. So super excited to see the International Evidence Collaborative starting its 2023 event programme again. And we want these events to be as useful to you as possible. The last air meet we had, there was a resounding, yes, we want more of these. So I'm going to hand over to Marie just to do some housekeeping.
Thanks very much, Anne. That's great. And as Anne said, we want these to be really useful. And in the Evidence Collaborative, a core team of us have had our heads down, been very busy producing a large suite of evidence summaries. And over the next few months, we're going to be talking about those with you. But we're also looking at further work that we're doing. And we've started putting calls for evidence out amongst our networks. So if you're not already signed up to this network, please do sign up. We will be putting the link in the chat at the end of the session. But it allows us to say, look, we're looking for new emerging evidence in this particular area. Have you got any reports or anything you know of? Because as we know, not all the evidence is peer-reviewed and published and easily searchable, and which is why we rely on this fantastic collaboration here. And I just saw Sean in Australia flash up a little message saying she's sorry to tell us it's really warm. All I can say is I'm very happy for you, Sean, but very, very welcome, and thank you for joining with the time difference as well. So, little bit of housekeeping. Your Zoom etiquette is perfect because you're all putting yourself on mute as you join. So thank you very much. That's incredibly helpful. We are recording, but I believe as you're coming in, you're probably having to agree to that. So that's all boxed off. We've got two presentations. We're doing questions at the end of each presentation. So any questions you've got, pop them in the chat. We'll be keeping an eye on that and trying to find those questions amongst all the introductions that are on there and the things that are going on. And I think that's it, really. Have I missed anything, Anne? Are we good? No, I'm shaking her head. That's marvellous. So we've got two presentations today. The first one is from who we affectionately call the two Helens. It's very difficult having Zoom meetings with Helen and Helen, but it's Dr. Helen Seers and Professor Helen Chatterjee. So Prof Chatterjee is my co-lead, and we've been working together on many projects for quite a number of years, and Dr. Helen Seers is also a business partner of mine. So it's just a very tidy little group of people, really. So Helen worked on some evidence summaries about nature. The majority of these were commissioned by Natural England and one by NHS England. So we thought it makes a nice package. And then after the two Helens, we'll be listening to Simon from Wavehill, and I'll tell you a little bit more about Simon at 12:30. So feeling very slick and proud that we're bang on time. So I'm going to hand over to the two Helens. Thank you very much.
Thank you, Marie. I hope you can see this coming through.
Yeah, we can see the slides. Thanks.
Great. Thank you for the introduction. Yes, we are a plural of Helens. We're going to be talking about the natural environment and health. What does the evidence say? So it's the esteemed Helen Chatterjee, who's a professor at UCL, and also the NASP Collaborative, and me. Oops, I'm going the wrong way. And me. I'm Helen Seers, and I'm part of the collaborative as well. So I'm just going to start the presentation, then hand over to Helen in a second. I'm going to tell you what we did. We were commissioned by NASP to do evidence reviews. It was this time last year that we started on this. Evidence reviews for Natural England and NHS England, commissioned by NASP. We delivered 4 reviews for Natural England, and we're going to tell you the headlines from them today. The reviews were Connection to Nature, Natural Environment and Mental Health, Natural Environment and Physical Health, and also looking at the natural environment, children and young people and how it supports them. And the NHS England review was interesting because that was specifically looking at natural environment and social prescribing. So that's very much of interest today. I'll just tell you about the methodology and then I'll pass you on to Helen. But we took a pragmatic approach to producing this evidence because we were time limited and we had to get on with the work and turn it around. We used the World Health Authority's organisation's rapid review methodology process. So we did a rapid review. We streamlined what a systematic review would do. And we were able to then look at the evidence and turn it around and actually do these reviews fleet of foot, pragmatically. We looked at peer review literature and also grey literature. So this rapid review, it did not look at every single paper like a meta analysis or a systematic review. It is an overview of the current research, and it was done pragmatically. It's not static, and we do hope to update things as funding and projects allow. And just reflecting back on what Marie said, please do join in with the International Evidence Collaborative. That's what it's for. We'd like to hear from you with your best practice, your evidence too, going forwards. Whoops, wrong way. This is just basically just to show you what we did. We built on previous summaries that existed. So we updated the Natural England summaries. That was the great work of Lovell in 2016 and Woodley from 2011 on previous evidence notes. We developed and consulted widely on our search terms to do this work using the PICO approach, but it is true that some of the search terms in these some of the emerging areas of nature and health are developing, and as the search terms and the research areas develop, better tagging of research will unfold, and it's something to work on. But we looked extensively in PubMed, Medline, Cochrane, all of these kind of databases for research, and we looked on Google Scholar as well. We looked at grey literature, which is unpublished literature, and networked with lots of different experts as well. And we looked at basically up-to-date research. So we did the searches this time last year. We screened them extensively and we got over 1,000 hits. And we used some really cool online software called Rayan to work collaboratively to really hone down the work. We landed on around just over 100 references to use across the 4 summaries. 64 were relevant to social prescribing, and we used those. And then we worked really hard to extract and understand and synthesize the data to high standards. Worked as a team. We assessed the grey literature to high standards, and we also looked at the actual primary literature to high standards using the Cochrane grading system. So I hope you feel that a lot of hard work went into this, and now I'm going to just hand over, if she's there, to Helen Chatterjee, and she's going to tell you what we found.
Thank you, Helen. Brilliant stuff. So guys, I'm going to give you just the headlines. As Helen has talked about, we were really focusing on getting some top headlines for how nature, connection with nature and engagement with nature affects mental health, physical health, etc. And what I really do encourage you to do is read the reviews, read some of the supporting literature that we embedded in those. Today, I'm just going to give you an overview because I'm conscious that we're short on time. We want to give enough time for questions. So I hope that sounds okay. So I'm going to start by talking about nature connection. This is slightly different from ways we might engage with nature. So this is very much about how we think and feel about nature. So not necessarily linked to how much actual time we spend in nature. So that's in some places quite a new concept or a new way of thinking about nature and health, but has been shown, as you can see from the evidence, to be really, really important. So how people emotionally, psychologically connect with nature, with the natural environment. What we know from these evidence reviews and many other types of evidence is that both contact with, so spending time with nature, and this idea of connection, emotional connection to nature, have a positive impact on health and well-being. We can see from the many studies included in this review that nature connection, that psychological connection with nature, is linked to higher mental well-being and lower levels of anxiety. But what we found in the literature, there's really big disparities, both in terms of the research and evidence that's available, but in terms of those opportunities that are available for people to connect with nature. We know that that's not equal, and there's a whole range of different types of reasons for that, and including barriers, for example, around availability and accessibility of particularly quality natural environments, and we can have a whole separate discussion about that. But we know that that really limits people's ability to be able to thoroughly connect with nature and get benefits from it. Next slide, please, Helen. So here's just some of the headlines around what we found in terms of greater connection to nature. We know, for example, that there's greater connectedness reported following visits to rural and coastal locations compared to urban green space, and that is almost undoubtedly connected again to this idea of the quality of the natural environment. We get, if I could ask everybody to, thank you. And so that idea again of having access to quality green spaces, and by things like we mean about things like species richness, the quality of that environment in terms of its natural intrinsic properties. We saw examples, for example, studies that showed that visiting nature once a week is associated with better health and pro-environmental behaviours. And we can talk again about what we mean by pro-environmental behaviours, but that means things like proactive behaviours towards increasing quality of environment, reducing pollution, or recycling attitudes, for example. And we've seen great evidence around children and time in outdoor activities increasing their ability to connect better with nature. And then the direct corollary of that is increased well-being. We find better relationships, positive relationships between contact with nature, connection to nature, health and well-being, and all of these pro-environmental behaviours. So both spending time and connecting to nature are linked to these really important behaviours around being more environmentally friendly. But as I said, connection to nature is not equally distributed. So we really need to think about that and what that means for us in terms of, for example, provision and accessibility in areas where we don't have good quality natural environments. Next slide, please, Helen. So next, let's talk about nature and mental health. Now, when we're talking about these two different types of evidence, mental health and physical health, we're of course not suggesting that those two are separate. We know there's really great evidence that there are of course links between how healthy you are psychologically, emotional well-being, and your physical health. I mean, a really great example is physical stresses that have an emotional response and vice versa. But what we can see is that there's really great evidence around the acts of engaging in nature and benefits of spending time in nature and improvements in our mental health. Also associations between living near natural environments associated with, for example, lower stress and faster recovery times from mental health issues. And some really great sets of evidence around green interventions, and we hope we'll be featuring some of those in our webinar series going forward to give you some examples. And I can just see from the chat that some of you are already involved in those sorts of activities. And we've seen that those types of green activities, and that could include everything from kind of gardening-based activities, green gym type activities, through to healthy walks, hiking, creative arts-based activities in green environments. These sorts of interventions and activities can deliver really great mental health positive outcomes. And there's also evidence that they show a positive return on investment and help reduce inequalities. So do have a read of that evidence. Next slide, please, Helen. So here's just some of the sorts of data that we're getting from some of those studies. Here's one talking about the amount of time to spend. So that's a really important issue around what we might call the dosage effect, which many of you may have been asked about before. Well, how much is a good amount of time to spending? What type of activities should you be doing? And a study has shown that spending at least 120 minutes a week in nature is associated with positive aspects of health and well-being. There's really good evidence around gardening and spending time in gardens in the context of social prescribing. So social prescribing interventions revolving around gardening, having a positive effect on mental well-being, as well as physical activity and reducing social isolation, for example. We know that exposure to natural environments is associated, for example, with greater associations between achievements and enjoyability, social contact, and that they're important pathways to staying mentally healthy and improving positive mental health outcomes. And here you can see some data in terms of cost effectiveness. So nature-based initiatives for people with mental health issues, as shown in one study, to give a return of £2.35 up to £10.70 per £1 investment. So that's a great term in terms of investment models. Next slide, please, Helen. So in terms of those links between physical health, again, we found really great evidence for good positive relationships between nature and physical health in terms of things like the immune system, for example, increasing physical activity, and then a direct corollary of that related to things like cardiovascular health and weight reduction. But as we talked about before, we're seeing consistently inequalities for certain groups, particularly people on low incomes who are more likely to face barriers to accessing nature. And we saw good evidence around interventions in nature to increase physical activity can be cost effective for the health system. So again, some really important things around bringing different types of evidence together to help think about what interventions, where they should be happening and who they should be targeted at coming out from that. Next slide, please. Thanks, Helen. So there's strong and generally consistent evidence that greater amounts of natural environments around the home, so in close access to where you live, are associated with lower rates of all causes of mortality, which is really significant, isn't it, if you think about that? So direct relationships between the health, how healthy you are, and what green space and quality natural environments you've got around you. For example, studies showed that adults and communities exposed to local green spaces show a reduced risk of type 2 diabetes and obesity and an increased likelihood of physical activity. We've seen studies that show that green spaces promote relaxation, encourage physical activity, engagement with nature, increasing social activity, and that protective effect in terms of air pollution. Next slide, please. Thanks, Helen. So there's also really great evidence around children and young people. A lot of those studies we talked about before are associated with adults. So what we're interested in is, can we see the same sort of protective effect for young people? And there's some increasing evidence around this, though not as much. So again, some really good indicators for us in terms of where we should direct the evidence base. So we found great studies showing that spending time in nature is good for children's health, increasing physical activity, well-being, and really important in terms of child development, those issues around cognitive performance and cognitive development. And one study showed that 87% of children and young people say being outside just makes them happy, very happy. That's good news. And again, these issues around inequalities, families on lower incomes and minority groups often having less access to nature, and then that having an effect on the opportunities for children, that children spending time outside without adult supervision continuing to decline. So that needing to provide those opportunities for children to have more opportunities to spend time in nature. So again, thinking about that, what does that mean in terms of what kind of activities, interventions and locations should we be promoting this activity in? Something to think about in terms of schools, for example. Next slide, please, Helen. So we saw from the studies in terms of young people that access to green space is associated with improved mental well-being, overall health and cognitive development for children. But some really interesting studies coming out recently around, for example, specific interventions targeting children who have particular challenges. So, for example, promotion of restoration of attention and symptoms associated with ADHD. Improvements in things like behaviours, memory, competence and support of social groups, self-discipline and moderated stress for young people. And again, that those effects really important to think about in the context of young people and what opportunities and accessibility they have in terms of those potentially protective effects of spending more time in nature, but those associated inequalities that we've just talked about. Thank you, Helen. Next slide. So just some general comments, I guess, about how the natural environment can support health and wellbeing before we just move on finally to some recommendations. As we've seen, spending time in nature is linked to a range of positive mental and physical health outcomes. We've seen from evidence that nature-based social prescribing interventions can positively impact happiness and well-being through reducing social isolation and developing connection to nature. And we've seen that both contact with and connection to nature play an important role in improving health and well-being. But what we know is that there's still gaps in our evidence. So we really need to keep working on the evidence base, carry on collecting that really important evidence, particularly around contact and connection to nature and the impact on health. Next slide, please. So one of the things we did in these reviews is think about what sort of recommendations going forward. And so in the last few slides, I'll just pick out some of those implications that this evidence is leaning towards. So we've talked about inequalities, and I think there's going to be more and more evidence coming around the issues of that and the potential for increasing accessibility to natural environments where that can help with levelling up. And you'll have seen recent announcements about more investment in levelling up. Be interesting to see how much of that has been associated with things like green and other natural environments. We're really keen that policy should focus on providing access for audiences who can't readily and easily access great natural spaces outdoors by addressing those restrictions and creating high quality accessible green spaces and blue spaces, I imagine, in deprived urban areas. I mentioned schools, and we think that there's real opportunities around schools and educational organisations being supported to provide learning opportunities in natural spaces and the outdoors for children from all backgrounds. We know that there are issues around barriers such as transport and entry costs for parents accessing natural spaces, and this should be really looked into, so thinking about perhaps a waiting system in terms of charging. And we need to also support adults to feel more confident in spending more time outdoors with their children. So again, that could be an idea in terms of thinking about those social prescribing green interventions. What do they look like? What kind of activities you do, and how can they involve the whole family? Next slide, please. And that sort of links to this idea really that we think that, I mean, all social prescribing, we would argue, but that nature-based solutions should be co-designed and co-produced through partnership. Most importantly, with those participants, with your target audiences, and with all of those different partners and stakeholders that are involved in providing that. So both from the referral end right through to the provider end, and those audiences and communities that we're trying to connect with. We know that we need more consistent and better methodologies used to evaluate health and well-being impacts, again, of all social prescribing interventions, but in particular nature-based activities. These are complex, non-clinical interventions and activities. So we know that we're seeing a whole multitude of effects and outcomes. So gathering that we know is very complicated, and there are multiple ways of doing it. But what we would argue is gathering evidence around all those different elements of the activity in the programme, both for the participants, the providers, the stakeholders, all of those different people, is really important to capture different aspects of health, well-being, cost effectiveness and value. We think that the future research should include health service use and community outcomes as recommended by the NHS long-term plan. And we think that further research should be conducted on cost effectiveness. We found relatively limited evidence around those understandings of value, particularly from an economic perspective, to see if taking part in activities in the natural environment is more cost effective than in other settings. Next slide, please, Helen. So this is really just a reminder, we've just had a snapshot here of some of the evidence that feeds into these reviews, but what we would really encourage is to have a read through those reviews. And as Helen and Marie have said, please do continue to engage with us by joining the Evidence Collaborative and send us details through joining the collaborative. That's where you can share the details of the great work that you're doing, having conversations around what do we mean by effective evaluation. That's an important piece of work for us, Marie and Helen and our team and I, going forward, is understanding these approaches to better collecting evidence and data around evaluation, and also doing work around cost effectiveness and value. So again, if you're working on that, please do share that, and particularly if you're working on it in relation to the natural environment. And I'll finish up there and thank you all and hand over back to Marie.
Thank you very much, Helen and Helen. That felt like a whistle-stop tour, but some amazing headlines coming out. And also just to say thank you to Kevin Husk, who also worked with us as part of the collaborative and particularly helped design the search strategies as well, from his experience of working in the green environment. So lovely to see you, Kevin. Thank you very much as well. So let's just see. So yes, we are sending out the slides and this is being recorded, so it'll get circulated to everyone in the International Evidence Collaborative, or if you signed up via Eventbrite today. I haven't seen any questions in the chat because I think everyone's like, wow, we've got evidence summaries. Sarah Parsons, you've just put your hand up, so I'll come over to you if you want to unmute yourself and ask a question.
Yeah, absolutely. There was a couple of points, actually. I think the first point, a question I'd like to ask is around, on one of the last slides, it was talking about the access to natural environment should be equal for all. I'm just wondering if there's any evidence as how that relates to people who call prison home. And the reason I say that is because on top of the work interest that I have in that, I also volunteer in a prison. And this is something that we've picked up about addressing the mental well-being of people who call prison home, when all they basically get to see is a very grey prison, you know, exercise yard, so to speak.
That's a great question, Sarah. Prof Chatterjee, or HC as I call you.
Yeah, and Kevin might want to chime in, and Helen. We've definitely got good examples of social prescribing stuff, a few emerging around prisons, but actually in terms of green space, I don't know of any. Helen, did you?
No literature came up specifically related to do that, but I do know, and I do see often quoted, that horrible thing where people say people in prison are made to be outdoors for X amount of minutes a day, and then they contrast with other people in their normal lives that don't go outside at all. But I have not seen it in the literature. So I do think it's something to keep an eye on, though. That's a very good call. Thank you.
Yeah, definitely, because I mean, basically, because I volunteer in a prison as well, and they get an hours association outside in a grey exercise yard. And
Thank you. Thanks, Sarah. I can see this has really sparked the chat going. So I urge you all to have a quick flick in the chats. There's all sorts of stuff asking if RHS have done a study of prison gardens and all sorts of stuff. Can I just ask a question, which, so when we came to do all these reviews, my kind of lack of expertise in the green evidence area made me question, what's the difference between, can I just ask you all just check if you're muted? Because I can hear typing in the background.
Typing.
What's the difference between contact with nature and connect with nature? Because I think that's becoming quite an important distinction for the evidence, isn't it?
Yeah, well, that, I mean, and Kevin might want to chime in here, and Helen as well, is that idea that connection to nature has really come about, that idea of the sort of psychosocial connection to nature. So how you feel about being in nature, and that has a direct relationship, the evidence has shown, has a direct relationship with then the amount of time that people spend in nature and then what they're doing in nature. So that idea that you can just by simply feeling connected to nature. So how some people simply, you know, just don't feel connected to nature, particularly people in urban environments where you just don't have access to green stuff. You know, you don't have access to green spaces or blue spaces, or if you do, they're very poorly maintained. You know, it might be a little bit of grass on a verge, so as opposed to, you know, much more higher quality green spaces. And I guess that idea of the quality of the green space is directly linked to this idea of nature connection, because when we're talking about sort of quality spaces, that's, for example, where you might have a much greater variety and diversity across the natural environment. You haven't got as much kind of pollution or you know, degradation, rubbish, etc. So that idea that how people are feeling in terms of their connectedness. And so there's been, for example, various, as you can see in the review, there's various scales that people have developed to be able to assess individuals' connection to nature. But it's a really important thing to value in terms of working on that, in integrating that, how you can work on people's feelings of greater connectedness and emotional connection to nature, as opposed to then that idea of actually spending time in nature, so engaging in different activities, whether it might be going for walks, hikes, doing gardening, for example, so simply spending time in nature.
Brilliant, thank you for that. I think I think it's a really useful distinction that we need to become more kind of confident at using when we talk about nature and evidence. I think there's lots of stuff going on in the chat now, so I'm delighted that you've all suddenly sprung into action, and there's various things being shared. And shared the link for the NASP evidence reviews, where you can find all the stuff we've done, and perhaps Sonia or Annie might want to share it every like 10 minutes or something. So let's move on. We're still on time, which is fantastic. So thank you, Helen once again, and Kevin and Rabia and the team that did all of the natural evidence reviews. So now I'm really delighted to invite Simon Tunner to speak, and welcome Simon. Simon's the principal consultant at Wavehill. So Wavehill are a social what we call social research company, and I found out chatting to Simon just before this that it's also an employee-owned company, which I think sounds really interesting as well. Now, Wavehill, Simon and colleagues actually evaluated the Thriving Community Scheme, which was a fund set up by NASP to really get some projects going. So I'm not going to say anything else, but I'm going to hand over to you. Welcome, Simon. So feel free to share your slides, and we'll do some questions after. So as Simon's speaking, if anyone's got questions, then pop them in the chat.
Thanks very much, Marie, and thanks for having me this afternoon. Well, it's this afternoon now, isn't it? Yeah. Thank you for having me this afternoon. Just to confirm again, these slides will be shared with all the material, so you'll be able to have a look at those. I'm going to fly through them and not talk too much detail around some of the content until we get to some of the recommendations, because I think that will help some of the thinking and some of the discussion. But there is a full report that's associated with what I'm talking about this afternoon, and obviously you'll be able to see the slides, so you'll be able to get the full detail there in terms of how all that fits together. Just in terms of the Thriving Communities Fund, it was launched in late 2020, and it was specifically about investing just under £2 million in 37 projects, although 36 actually went ahead. And it was specifically looking at bringing together partnerships around those particular areas. And, as the two Helens highlighted, a key element of that was environment and nature-based activities to develop and contribute to the improve and increase range and reach of social prescribing community activities by using those activities to kind of develop partnerships, but equally develop activities that kind of took these things forward. It was obviously primarily funded by NASP, but equally a range of other partners had interest in this, as illustrated in the logo at the bottom there. So it's probably one of the largest logos you've ever seen, but obviously we'll make sure that everyone's represented. And we had the privilege of conducting the evaluation. And I have to say it aligns with a lot of work that we've been doing for a number of years around social prescribing and continuing to be involved in that. And we've been really glad of that opportunity, and so further extending that thanks to NASP for giving us the opportunity to be involved in this. This infographic just kind of summarizes some of the key things. I'm not going to focus too much on that because some of these key points are highlighted, but that I would point your attention to that in terms of capturing the overall sort of scale of delivery and other things that came out of deliberately from that funding that was provided for the Thriving Communities Fund. In terms of the overall reach, it did have particular success in targeting particular communities. And this was where the real benefits came from this kind of approach, because in terms of the bids and the ideas that were coming forward in terms of that funding, it was very much about encouraging different community groups and partnerships to come together to focus specifically on particular groups, particularly those living with dementia, homeless people, unpaid carers, ethnically diverse communities, children, young people. But equally, there was a specific focus about trying to pick up groups that were particularly affected detrimentally by the COVID pandemic as well, to see it, the ways in which, as that Helen identified earlier, the fact that that was also tackling that social isolation that came from that. And although the timing of the pandemic and its impacts clearly affected the delivery of the projects, in terms of curtailing some of that and delaying some of the partnership activity, what was very clear was that one of the things that came through there was the fact that that did contribute to enabling people to re-engage back with activities and act sometimes as a very much a first step for those individuals to come back. What it is clear, though, from the evidence that we collected is that there's lots of opportunities here for that greater alignment of social prescribing to local needs. And that was what that first point kind of illustrates, is the fact that by targeting that, there is a real role here for social prescribing and developing the partnerships around that to kind of address some of those things and really ground these things in terms of specific issues that are happening within that local community, and use that to drive forward and engage people through that level of interest that comes from that. Overall, the program supported significant numbers of people across the overall program of activities. Just under 11,000 people were engaged. Significant groups from those target groups, particularly around ethnically diverse communities and the long-standing health condition. And equally, there was particular through this targeting came in terms of picking up those most deprived areas in England. And we saw in the previous presentation how that lack of equal access is a particular challenge around nature programs, but consistently across social prescribing. And therefore, by using this targeted approach, it shows that those communities can be reached by targeting those kinds of things. So it illustrates really the kind of value of kind of doing those things. It was clear from the way in which the partnerships identified that they had been able to widen access, partly through the extra activities that they brought on, but that particularly came from the partnerships that they were able to develop, building existing links and building on those existing links, but bringing new partners into those arrangements. And in terms of the projects that they ran, there was a very strong link in with the fact that the referrals that those projects were picking up were coming predominantly from the wider health system. So by explaining what they were doing and making those links and having those, the elements of the wider health system as key components of the partnerships, that was a good way in which to get people involved in these new activities. And particularly it demonstrated that there was excitement amongst the wider health system for these new activities that were coming on board, particularly in the subject areas that were being covered through this. In terms of the main reasons that people are taking up, and this kind of links with what I talked about earlier, the link to COVID and the fact that the timing of Thriving Communities kind of really seemed to act as that first stepping stone. It was very much about tackling loneliness and social isolation, and particularly around anxiety and depression, which, the evidence shows and continues to show, what the ONS are talking in terms of the 4 measures around well-being, is that there's still been a detrimental impact on the measures that they use. And this obviously is a key way in which individuals could be engaged through this as a mechanism to kind of act as that first step to re-engagement, particularly for those groups most affected. And the appeal of the activities that were put on was strong in the fact that, significant proportion of people that were referred then attended those sessions. But that was often built around the fact that there was a lot of confidence building that came around that, supported by link workers, supported by individuals. So we saw lots of examples of quite extended levels of hand-holding and reminders going on to encourage people to attend and reminding them of the activities that were involved. Projects generally work with a significant number of link workers, and what we've fully appreciate, these link workers are significantly overloaded. They have very high workloads, and any opportunity that they can identify to link with other activities that perhaps help lessen the demands that caseload, that workload has upon them, is really opportune, particularly where it links to strong sense that there is a strong link up with particular local needs that are being demonstrated. And that can help ease that burden in terms of that way. In terms of the use of volunteers, very common, and effectively a lot of social prescribing activity, a lot of these activities wouldn't exist without volunteers. So there's really a need to make sure that the volunteer recruitment and management practices in here are absolutely as tight as they can be. Partly to manage that situation where individuals are referring themselves as volunteers and activities perhaps aren't on stream, to manage the fact that those individuals are kept on stream until the activities are available for them to support, but equally then making sure that they're properly skilled up and linked in with other things that kind of happen here. But particularly the use of volunteers obviously has financial benefits, as highlighted on the slide, but it's also using those volunteers to champion what activities are being made available, but also particularly around the supporting roles, to kind of facilitate that delivery and really drive that forward. In terms of the workforce, another element of this is obviously workforce development. And when I'm talking about this, I'm talking about both link workers and those staff involved in, paid roles within community organisations, but equally the volunteers. That workforce development is absolutely key in terms of driving that forward, both in terms of enabling those members of staff to explain what the activities are about and what they're trying to do, and do that in very engaging ways and encouraging ways, but equally encouraging them to think about the hand-holding and the confidence building activity that needs to happen around that, and the approaches that really work there, but also around the kind of practical elements in terms of the referral, the needs assessment, and that kind of awareness of other services that are available through social prescribing networks, so that information is kept up to date, but equally such that it's done in ways that are particular to those individuals that come from more challenged groups, to really work on that kind of softer element of referral, softer elements of outreach to really kind of support that. But equally, the other side to that is that the quality of that training also offers reassurance to referral agencies that they are then referring people on to a quality service. So sharing that sense of what that training and workforce development activity is also critically important in terms of driving that forwards. In terms of the range and profile of activities, the graph obviously shows, there's a particular concentration here around arts and culture. Notably, the project was led by Arts Council England, so that isn't particularly a surprise. But there's significant spread across different areas, and often projects combine different elements of these. It wasn't that they were just focused on the arts and culture; it was those other dimensions. And I think there's particular benefit in kind of looking at that kind of multidisciplinary, multi-creative kind of side to this, because it's certainly the sense in terms of some of the feedback we have from participants with the evaluation that they found that particularly appealing, and often it was a good way in which to engage those individuals who were perhaps a bit more removed from some of the and experiencing challenges around anxiety, depression and social isolation. Particular developments around confidence, skills and social connection, that was a particular area of interest for issues, and the fact that most of the sessions could be delivered face-to-face despite ongoing pandemic was obviously something that acted as that first stepping stone. This was reintroducing people back into kind of activities in their community, which often might not have happened for those individuals because of the experiences they'd had under COVID. Provided the opportunity for that social connection, as I mentioned earlier. But what does that then lead to? It meant that it was reopening people's eyes to the opportunities within their communities, being able to feel that they could take more control of their lives, to feel less isolated, but particularly through those activities and the connections they were making, it was new connections with other people. And obviously, we know about the health and well-being benefits of those connections, but equally, particularly coming out of the pandemic, that was particularly critical for those individuals, enabling them to kind of think about making those first steps and moving on from there. Particularly in terms of developing the links, that certainly what Thriving Communities had the strongest areas of development was partnership stuff, in the fact that it was developing those and strengthening links between the wider healthcare system, activity providers and the wider community sector. And I think this is a model that really needs to kind of underpin social prescribing going forwards. It's not that it's any one individual set of organizations' jobs, it's the fact that all those working together bring different elements and therefore bring that multidisciplinary, multi-creative element to those kinds of things, but equally provides a set of opportunities for people that then really chime with them in terms of the way that operates. Many of the projects had new partners that they hadn't listed on their the original application, and that was a particularly strong area, was the fact that just by getting the messaging out around this and looking at those links that could be established, and the picture here is a really good example of a homeless project in Rochdale that ran a community garden that was then linking up through the health service with particular community groups in the Asian community in the local area and bringing those connections together. But the thing is that the challenges that some community organisations face around capacity mean that this kind of partnership working is absolutely critical if this kind of delivery is going to go forward. And therefore, and I mentioned earlier, that workforce development also needs to focus upon ways of which upskilling people in that partnership development work as well, so that those partnerships can be capacity built as quickly as possible. There was lots of evidence around the commitment of support in terms of local commitments, and equally we saw in the stages of doing the evaluation that just under £1 million had been leveraged in against the original grant investment, 1.75 million as well. So again, Helen particularly highlighted the positive cost benefits in terms of the money saved there. Equally, it opens up opportunities for other funding to come in this, and I think there's a strong sort of pitch around this, around the health and wellbeing benefits that come from this as a mechanism for reaching those communities that most suffered under COVID. And certainly our public health authorities are really interested in mechanisms to deal with that and re-engage individuals back into some of those things. Just the last few slides in terms of where what we're highlighting is that it did show that thriving communities have contributed to an enhanced local social prescribing infrastructure and offer. It encouraged those local community organisations, including face settings, etc., to realise that they could make a contribution around supporting health and wellbeing, and equally that they could be confident about promoting that offer to link workers to kind of take those forward. I think there's still some challenges around navigating the social prescribing infrastructure, which is kind of a good problem to have, because it means that infrastructure is growing, but equally it still means that there's sense there about maps and journey indicators that need to be out there, both for professionals but particularly for participants, so that they can navigate that effectively. And clearly there's opportunities there for longer term funding around that to kind of make sure that those things can happen. In terms of the recommendations, I won't focus too much. I've got the last couple of minutes, but I think there's particular elements here that are really important. I think very much the greater coordination. I definitely think there needs to be work around accreditation or quality marking activities, so that link workers can be as confident as they possibly can be that that's the right way to go forward. Helen talked earlier about co-production. I think that's absolutely critical, because it really makes sure that it's grounded both in local needs, but equally in the needs of the participants. We saw the strongest examples where individuals felt they had a voice in shaping those things that were then driven forward. I think it's thinking about the wider infrastructure challenges around linking in with other aspects and how that could link to encourage greater volunteering. From a monitoring evaluation perspective, I think there's real challenges around capturing consistent profile data. We know the NHS has, data that it's collecting in terms of the activity that it refers people through its own social prescribing system. And I think there's real scope for looking at ways in which that can be brought in, but could be the basis for a consistent mechanism to kind of look at ways of which that data can be created, so that we can properly track through those systems, the impacts of social prescribing, etc. And also looking at ways in which that there can be greater maturity in terms of that delivery around workforce activity. So there's greater consistency on that. And also making sure that there's greater consistency around the coordination and management of volunteers. So that if you're a volunteer in a social prescribing setting, it's very clear about the ways in which you'll be supported, recruited, managed. And there's a consistent approach to that that then gives confidence for people that they see this as a long-term engagement in their terms of their volunteering contribution. And equally, there's very clear appetite, as we've seen from the audience in this session today, for significant networking opportunities to share practice, share understanding, share problems, and work together to kind of co-produce solutions on those. So that's kind of all the slides. Thank you very much for listening. If you're interested in contacting us, then please, the contact details are there. More than happy, but equally more than happy to take any questions that you might have. And thanks for giving me the opportunity.
Thank you so much, Simon. Those are such interesting results. I love the fact that there's a wider participation in those sort of key vulnerable underrepresented groups. I think that's a huge positive to all the work that everyone's done in all of the different projects. There's loads. There's lots of comments that have come into the chat and ideas. If anybody's got a particular question for Simon, perhaps you might want to put your hand up, and I'll just sort of we'll have a look between Sonia and I and see if
we did have one question for Simon,
go on then,
asking if there was any more information about training available for organisations who want to be part of the referral pathways. Tom Watkins, who I think is the East of England lead for Thriving Communities, he recommended getting in touch with the sort of lead for the Thriving Communities in their area, but I just wanted to check if Simon had anything to add to that.
I defer to Tom's greater expertise than mine.
That's a very simple answer. I had some thought. I think one of the things that I noticed, so always sustainable funding, so that's a difficult one that's gradually getting a little bit better. The consistency of collecting data is very difficult, isn't it? Because if you individualize to local need, then local needs are different. So there's lots of different outcomes, aren't there?
Yeah, it was particularly interesting, Marie, trying to sort of manage this across 36 different areas. You can imagine with multifaceted partnerships as well. So there was there was a lot of head scratching going on in the Wavehill offices. We think we've got to a position on it, but I agree with you. It is very much about looking at ways in which, using other systems, I don't think there's a need necessarily to identify anything new around consistency and measures, but looking to use those, in a cross-disciplinary way to kind of help structure some of that, so that there's a little bit more, not control, but kind of consistent approach around how the infrastructure is rolled out, how connections are made, how needs assessments are done, how the data is then assessed and collected, and that will help funders make decisions about the right routes that can go forward on some of those things as well.
So one of the challenges I think small organisations have is that their funders ask them for all sorts of different outcomes. So do you think this work would help be able to say, look, if you're going to look at some outcomes, that we found some common themes, or this is the broadest set, or it's realistic to choose the top 3 for your thing, or I'm kind of thinking of how we influence funders so that their asks are a bit more realistic.
I think the best way forward on that's a really good question though, Marie. I think the key point on this is that it's almost like developing a suite of measures across, it's almost like a long list, and then as part of a bidding process, you ask individual organisations to identify different components of that suite across a top 3 or top 5 that's most relevant to their activities. And then you've still got that ability to kind of cumulatively build those together. Obviously, it doesn't represent, the full population of everything that you're doing, but we're pragmatic. It's better to have at least some data than that's consistent than no data or very limited data that's kind of inconsistent across all the place, because that doesn't help anybody. And I think the key thing about this is the infrastructure developments will come if you allow those community organizations to feel, I can manage to do this, and you will get, and it's trying to think about the kind of greater good that comes from that, because that's where the creative thought, that's where the creative inputs can come from, that very kind of grassroots level. But you're not putting off those grassroots level organizations by saying, oh, great, you want to be involved, but we'd like you to run this 20-page questionnaire with everyone before they engage with the program. That just doesn't work. So, it's just thinking about those things. What are the critical elements? Doing, I think, some co-production work around that to then really fine tune, what are the top 3, top 5 indicators in those particular areas? What is it around environment? And we use things like the evidence reviews to kind of identify, an initial long list, and then work with the specialists in those areas and the community organizations work in those areas to then say, well, out of those, we've got a list of 10 initially. Which are the top 5? Which are the top 3 that we really need to make sure that every project is delivering on? You can provide some qualitative commentary around that explains the ins and outs of your project, but we've got some nice measures that come from that in terms of that focus. And that is a methodology that would then apply to a whole range, in terms of a whole range of other areas that we're doing evaluation in, where that is often the most common issue that we come across. How does a multi-agency partnership consistently collect data without deluging all those poor partners with, lots of detailed questions and all that kind of thing? How can we do that in a way that means that they feel that they're really getting something from being involved? Because then that's where the creative dimensions and the real insight and the real exciting stuff will come from.
Thank you, Simon. I think I really like your thinking, and I might come back to you separately on some of that as well. I have got a few bits of information to give you before we finish, but Helen from Nutri, you've had your hand up. So if you've got a quick question, why don't you let us know?
Yeah, thank you, Marie. What an absolutely fantastic session, and just found myself nodding along a lot there to what Simon was saying, is that there are boots on the ground that just haven't got the time to do the paperwork and just want to be very active. So is it a case that we look at those, maybe it's incumbents, maybe it's those that have awards and contracts of work, and maybe in the next round of sort of like procurement, everybody has to do outreach work to involve smaller VCSEs and community and third sector groups in program delivery for co-programming? If we make it a T&C of their payment criteria, is that they must involve the smaller innovative entities that have the answers and are doing the work and taking the action. It's like the experience just from a conversation yesterday with a real key stakeholder for us is that our sort of like way of working, our proposed or our solution, that working weight neutrally and training existing providers to work weight neutrally and inclusively to reduce health inequalities is so universal that we need to niche down and find a cohort that has money on the way, that will do some co-programming with us. I hope my chat here isn't too scattered, but it's like it's identifying, where money is flowing currently to then help channel into that all the people doing the work already. So less money gets spent on talking about action and more money gets spent on action.
Absolutely. Some really interesting points there. Thank you, Helen.
Thanks.
So that's a really good segue to say that. So there's a couple of things coming up that's really important for you to know about. So we've just hit 1 o'clock, but next 2 minutes, I've just delivered that information. If you want to stay on a little bit longer and have a chat afterwards, that's absolutely fine. We have got our next session is in February, roughly a month away. The Eventbrite link will get circulated very soon. So sign up again. So you can sign up to the International Evidence Collaborative. You go on our database and you will always get the emails, but we'll put all the links out via social media again. So the next one, we have Paul Wilson from Manchester University, and he's leading the NIHR funded national evaluation of social prescribing. I've invited Paul along. They haven't finished it, but I'd like him to tell us what is it that they're actually doing. Does he need to find any information from any of us? Might we have any points for him? So I just think that will be really interesting to find out the national evaluation, because data from that will undoubtedly have an influence on what ministers are thinking about social prescribing. So that's really important. And we're also going to be presenting some of the NHS England commissioned reviews. So there was an evidence review on creative arts, creative health. There was evidence review around physical activity and social prescribing. So it was sort of creative health, social prescribing, physical activity, social prescribing, and there was one on sort of social welfare justice and social prescribing. So we're going to tell you about those headline findings next time as well, and then we'll line up some more for March. I think it's really useful for you to know what else we've been doing. We've just completed a review on older people and poverty, which was commissioned by Independent Age with NASP, and that's been submitted over to them. So I'm hoping at some point Anne will be able to share that. That was fascinating, and it was all about what do we need to think about if we are designing schemes to support older people to address different aspects of poverty, and I learned a lot doing that with you. And the next one's coming up. We're about to put a call out for your support. We want to develop a resource document that gives you toolkits that already exist that support really small BCSFC acronym there to do evaluation. So don't inundate us now, because we've got a form and it will log everything, but we want to find out what's already out there. What do you use that you find is really good? What is it that you need information wise? So there's going to be a big call out for evidence and documents, and that's going to hopefully launch next week. And we are also working on a project around economics, and this is like a really big tangled ball of wool to understand how do you work out the economic impact, and we are starting down that path. So that's what's happening at the moment. So I just want to say thank you to all our speakers and the teams behind all the work that if you want to continue to share anything in the chat, do. You might want your lunch, so I'll say bye-bye, but if you want to stay on a little bit, then please do. So see you next time. Thanks very much, Simon. Bye.